Thank you all for staying present. We have 2 more really engaging opportunities to learn and grow with our colleagues here. I'm inviting my panelists up to the stage as I'm introducing. We have a panel discussion titled Youth Mental Health and What Schools Can Do About It. I invite our session moderator, Christina Borth, and well-known speakers, Dr. Joanne Elizabeth Wescott and Conrad Aquino, to come up to this stage as I introduce a little bit more about the session. What are the early signs and symptoms of mental health issues in youth? We know that the world has changed in the past 3 years, and it will continue to change at a more rapid rate than what we've ever expected before. So anyone who's into technology here, raise your hand. Okay. So the technological advances that we had from the year 1900 to the year 2000, which took about 100 years, are going to happen in the years between 2020 and 2026, and we're in 2023. So I want you to kind of think about that. 100 years squished into 6 years. This is what we're all experiencing in the moment of now. So this is a very relevant conversation. How do we, as educators, identify and address the issues our youth are having in the classroom, in their homes, and just what can we do to support students experiencing mental health difficulties? I let it go to our panelists. We're ready?
Well, I've been excited for this all day, all week, the last few weeks. Our conversations have been amazing in prep, and I will say I'm really nervous as well, just to get in front of all of colleagues and speak on something that we're so passionate about. So I think I'll just introduce this really quick. And so I'm Christina. I often go by Stina Borth, and I'm a keymaker. So I use that term because Keymaker means I'm making the key to open the doors. And when that door is closed and you can't find a way through, you've got to find the way to make that key to unlock it. And most of the work that I do in my company, Keymaker Youth Support Services, came out of my experience in education as an educator, specifically working with youth with unique abilities, and really getting frustrated with those blocks, those doors that we kept smashing into. And I don't have the patience to wait for the rest of the system to figure it out. So I often bring others in the community, that's parents or other providers, along with me in creating that. Conrad is a TEDx speaker, multi-award-winning author, life coach, physician, and nurse with over 20 years of healthcare experience. He goes beyond seeing patients. He's driven by the bonds that he builds with those patients over the course of time, and that belief of treating the illness is only secondary to what he does. In the modern era, when the healthcare professionals are overwhelmed and focused on curing the disease, Dr. Conrad looks within the patient and sees a person with a story, and I love that. I love that about you. Dr. Joanne Wescott is a well-known innovator and an inspirational leader, passionate about healthcare equity, experienced author and expert in strategic leadership, very insightful in exploration into the publish of the psychological effects of the COVID-19 pandemic, which I'm excited to talk about with you. And through her writings and speaking engagements, online resources, she offers guidance and support for those struggling with the profound challenges brought about by the COVID-19 crisis. So should we get started?
Sounds good.
So our first question that I am excited to speak about is, how can schools equip their teachers and staff to be better supported and support their youth mental health? And I'm going to just kick us off with, there's a lot we can do. And really, the biggest thing that comes to my mind is providing education, language, and instruction. And ideally through direct instruction, not just in the background or layered through the academics, but speaking about it directly and giving the word to what that feeling or that sensation is. How is it manifesting in their nervous system, in their bodies, and allowing them to grow their voice from even a young age. I think also we need to create a working and learning environment that houses healthy mental health for our educators which majority of the time we don't have. Those prep periods are not prep periods. The breaks and the time in between classes, it does not allow for enough of processing and downloading of all of the instruction that's happening, everything that's coming in at the youth as well as the educators. And that ends up in creating unhealthy teacher models, if we want to use that, for our youth. Dr. Wescott or Conrad?
Well, I can go ahead. When we talk about the mental health of our youth, our children, our kids, the next generation of tomorrow, we talk about the schools and the systems and the type of education or curriculum they provide should include all of this, right? But one thing that we're missing is also the role of the caregivers as parents. Now, I'm a parent of 3, 17, 12, and 9, and, we're also, you have to think about first, how do these kids learn these life skills? And coping with stress, the mental health, is part of the life skill. How do we learn how to tie our shoes, walk, run, pray, all of that, right? It comes first from us as the caregivers. We pass this on to them. The easiest way to do this is to push the onus to our schools. Hey, they're in school age, so you deal with that. But no, it should start with us first. And just like everyone has been talking about today, it has to start with us. Now, one of the questions that we want to ask, if it does start with us, how now do we know that we have the right tools and resources to provide to our kids when we ourselves, are having difficulty in trying to cope with the stresses that we have? We come home after work and we're just tired, we're exhausted, we don't want to do and deal with any of this, right? But still, now that is being seen by our children. Mm-hmm. And you might not be a parent, but you could be a caregiver, an aunt, an uncle, a grandparent, and this is easily seen by our children. And they learn from us. They learn from the caregivers. So the number one thing, just like what Dr. Brian is saying, first focus on yourself, okay? And if you are able to focus on yourself, then you can start giving to others. And it helps yourself, it helps your kids. And that's where we need to start first, right? And after you start doing that, then it starts to become a better place. And when the teachers come to you like, hey, there's something wrong with your child because he's not performing or he's not doing this, and then the parents are like, what's wrong with my child? He's the best child ever, or she's the best one ever. Like, what are you talking about? And so this is your problem. You deal with it. No, it's not like that. The teachers are here to help. Right? We've identified an issue. We need to do this as a team. We're a team. We're not telling you that your kid is wrong. We're just saying that, hey, we need him to be successful. And in order to be successful, we need to come as a group, as part of a team, to be able to do that.
And in order to come together as a group and to be a team to do that, we can structure that out by having mental health training. Schools can provide regular mental health trainings, workshops, professional development programs for teachers and staff. The trainings can include topics such as recognizing signs of distress, listening and communication skills. Also, resource accessibility. Schools can ensure that teachers and staff have access to mental health resources, such as books, articles, and online access. Collaboration with mental health professionals, because let's face it, a lot of our instructors in school, they do not have the mental health training. So if they collaborate with the mental health professionals, schools can foster partnership with local mental health organizations, therapists, and counselors. to give them structure. Support school culture. Schools can create a culture that promotes well-being by encouraging open communication, positive relationship, and self-care for teachers. Peer support groups. So we will need peer support groups for the teachers as well, so they can have breakout sessions. They can get together and talk about some of the exposures that they're seeing in the classrooms and how they themselves are impacted by seeing the children have these mental health crises, as well as discuss their experiences, their challenges, their strategies, and support the youth. Because if you don't have these sessions where you can come together and have a discussion, such as what we're doing now, collaborating, we're putting our heads together and strategizing what is best, what we need to do, and then what I may know, someone else might not know, and vice versa. And when we come together as a team, we can do a lot more. As they say in my culture, it takes a village. Mm-hmm. Exactly. So while it's been challenging to address all the needs given limited resources, these steps can help create an environment where teachers can feel comfortable, because they're too going to be introduced to courses and a nuance of way of teaching, instead of just singling that child out to say they need to go to special ed or there's ADD, ADHD. It's not necessarily that. They're having some mental crises that need to be addressed.
And really, even to expand on that, is that even if we can, and well, not if, when we provide that, mm-hmm. is that to expand it to that somebody comes in and we co-teach or we support that application. Because I think that there's a lot of, people can receive, educators can receive, parents can receive, yep, this logically makes sense. We want to do this. But then putting it into action, there needs to be support and facilitation of that, to really perfect and make it so that they have those skills.
Exactly.
I mean, what I see all the time when parents and I meet is they get it. They understand, they're like, I'm following you, but then putting it into practice during a busy life, mm-hmm. or when you're in the classroom and you're managing mm-hmm. all the students, and you understanding that in the IEP meeting, but then actually being able to apply it, there's something that drops off. And that's where I think the action is needed. We need to start going in and supporting each other and saying, yes, we are family. We are part of the same team.
Exactly. That's
so that knowledge can actually be seen in real life.
And that's right.
And the thing is, here's a greater question to ask ourselves, like, how now can we influence mm-hmm. the educational system in a national level yep. to make all this change? It will take time. It will take voices to be able to do that. So while we're waiting mm-hmm. for all of that, we can start from ourselves, mm-hmm. right?
And to add to that, too, you said, what can we do? With the suicide on the top of the list, with all of the behaviors that we like to call it, that are acting out in the communities and the violence that we are seeing, I'm sure that the government wants a solution. It's going to be more than a solution and just take the guns or lock the person up. So they see that there's a need. Now, once we build the platform and we give them a structure, because they're going to want to see things laid out structurally, how effective this can be. When we give them that, and then we implement that, even if we do a pilot in maybe a school that will allow us to do that, and that becomes successful, then we can take that pilot program and then we can move that on once we have, again, the data.
And I have seen that in real life, where actually if given the opportunity and we're having a conversation, whether it's an IEP meeting or just an inquiry of mm-hmm. a consult, as soon as I say, I have something, here, what if we try this? Mm-hmm. Or I'll come in and mm-hmm. I'll help you. They're receptive. Mm-hmm. Schools are receptive, parents are receptive. It's just that it seems so big, and it is. But every small step, when you bring it together, it makes a big difference, right? So we just have to have that determination and believe that we can continue to make those keys, open those doors.
And I totally agree with you. Sorry.
Yeah.
I totally agree with you. Because one of the things in my company with Delmarva Community Consulting Services, we work in the community, that we support the community in when they're having crises, was a disaster. So sometimes starts with the small person. It starts with the little guy, to be able to be reachable and approachable so that the community will feel comfortable to come to you. And then, of course, we network and we connect with the bigger global industry to be able to provide the resources and the information that's needed, because as a little company, we can't do it by ourselves. But that is very, very true. And I know that for myself, by having hands-on, providing mental health resources, providing being an advocate as to directing people where they can go. I've had so many to come in my website asking for help, because they're doing it anonymously. They don't want to come in and say, hey, I need an appointment, I need to see a psychiatrist. They have a subtle way of doing that, of asking for help, and they don't always call the hotline. So my company is there for that, and I'm pleased to be able to say I've had a lot of support from the bigger mental health organizations to be able to supply what I need to be able to get it to the communities. And then as they go up the chain, and they win your trust is the biggest part of it, then it can be helped.
And as you were speaking, I was just thinking about how it really speaks to the need of normalizing mental health. Normalizing as mental health maintenance, everybody needs it. Everybody needs to learn this skill. It's a lifelong skill. It doesn't matter what the diagnosis is or the label, because you know what, the labels, they do change as well.
Exactly.
So let's get rid of those and just
Yes.
talk about, this is the experience, this is
Yes.
what works for me,
Yes.
or I don't know what can work for me or my child, and really work on that and start using that language and normalizing it. Like I talk about all the time with my clients about co-processing and co-regulating, and they go, Stina, what are you talking about? What the heck is that? It's because there's no language we don't talk about. We haven't normalized it. But if we do more of that in our professions, in our communities, then the parents can do it, the kids can do it.
Right, and we also have to start normalizing these conversations at
Yes.
home.
Exactly.
At home. So we need to start talking about this with our kids, starting
Yes.
to teach them this lifelong skill to be able to do that in the right way and not in a destructive way.
I totally agree with you on that. That is where the foundation starts, is at home. And now we have to incorporate your mental health, because if your mental is not healthy, then you cannot be productive. You become a liability in society. So a lot of the millennials, I'm sorry, I don't mean to label you, but a lot of the younger generations, I want to say, you know, they're really having a difficult time trying to grasp, where do I fit in, what do I do, and how do I do that, and then want to be independent and want to make independent decisions. So once again, I implore upon them, come to us, come to someone who has walked the walk, talked the talk, and we can advise you, we can talk to you. We don't want to try to control you, but we can prevent a lot of the mistakes that you will have by just making erratic choices and just sporadically spiraling out of control. It's not necessary. We too, as leaders, we deal with a lot of the mental health issues. We deal with it from the top. But as we come together and collaborate together as leaders and put our minds together globally, because what has happened to us from the pandemic, now that we're post-pandemic, it has affected every one of us, regardless of your gender, regardless of your culture, regardless of your belief. We all breathe the air that had the COVID. And so with that being said, we are here today from all parts of the world, from all different faiths and beliefs, to come together to try to find a better means for tomorrow. And that's what we have to do. And in order to do that, our biasness have to be put aside, because we want to wake up tomorrow and be able to live in a productive world. And let's face it, it takes the global economy to be able to produce and give us a satisfactory life. We're no longer living in a stone age where we're just isolated and it's just about me and about you and them. It's all of us. It takes all of us to do that. So with that being said.
And it starts with our kids, our education. I mean,
absolutely.
It does start at home, but it also, I think we have to recognize there's lots of hours that our youth are in the education
Yes,
system.
and your first
And-
behaviors you see is from the children when they are rearing, from young kids. That is the first behaviors you start to see. And if you don't structure that behavior and put it into some normalizing, that's when it spirals out of control. And, parents are working, some are ignoring, not wanting to deal with the problem, or they don't know how to deal with it.
Right, and I like the dad response is, walk it off. You're going to be fine. And the mom response is, oh, you're fine, you're going to be fine. But we're not teaching them the right way to cope with those stresses.
It's absolutely
And
true.
it's possible that it's because we don't know either. We haven't done the
Right,
work.
right.
And a lot of times the opportunity wasn't given to our parents. They weren't given the education, they weren't given the access. And so now it's our job within the system, within the education system and in our community to provide that. Because all it's going to do, if we just ignore that and say, well, it's on you, you're the adult, you figure it out, it's for the benefit of the child and for the youth or the young adult that we're working with. And then that's going to be the change. They're inheriting
Right.
this world.
Yes.
That's
So
right. And that is very true.
we want to give them those skills and empower them to make those decisions and be able to regulate and be able to navigate the stresses and coping.
Right.
That's
So-
very true. Let me get this one point out. It's at the tip of my tongue. When we went through the pandemic phase, we were all instructed to do what? Stay indoors and forced to live a sedentary lifestyle and to not be able to socialize. We were told everything possibly of what not to do. But not one time since we've been going through that pandemic and now post-pandemic, what do we do to recover? What measures, what steps do we put in place to get us back to some sort of normalcy in life? How do we get over the barriers, the stigmas that cause us to have issues? We know that the crime rate went up. Domestic problems went up on the rise. A lot of times the children, their outlet was to go to school to be able to get a meal, to be able to get away from some of the domestic issues that was occurring at home. But we were never instructed on what do you do to help your mental health when you're going through this? You lost your job because you didn't take the vaccine or you had COVID. So what do you do now that you don't have money and you don't have the resources to provide for your family and you no longer have your job? Nobody knew what to do. And you didn't have anybody that you can consult with because, once again, business was shut down. So now we're at a crucial time where we want to go back to what we call a normal life or what we did before, but let's face it, don't hide behind the mask. Let's address the mental health issue because it's there. It may not be as traumatizing for some, but the trauma is there.
Right. So, actionable step.
Yes.
Okay, so what can we do now to be able to help them? So, we're all here today because we are agents of change. So, the challenge for each and every one of us is to, start one extra step. I know we're already doing this, trying to help ourselves mentally, but take one more small extra step to get that going. Pick up another book, go to yoga, take like 15 minutes of meditation every day, something small. There you go. So yes, so if you leave here today from this conference, please, that's just one step. It helps you, it helps others, it helps the kids.
Yeah. And I think it would be to bring in the language to talk about that mind-body connection and how is that anxiety or that sadness, where is it manifesting in my body, and being able to normalize that in family conversations as well as the classroom. Because I think what a lot of what we've grown up with or what a lot of our kiddos experience is that it's just inferred, and that's not enough. We need to speak directly to it. We need to teach a lesson like we would teach reading. Step 1, here's the instructions. Now let's see if you understand the vocabulary and go through it. These are the things that you can use as tools and strategies to be able to regulate and connect with others.
Yes, and don't be afraid. That old saying that we had to go through to tell the men, suck it up. Suck it up. You're a man. You can handle it. Don't worry about that. It's a vulnerable side of the men, alpha males as well. don't be afraid to just say, I have an issue, I have a problem, like this young man did here. He self-searched himself. He searched his heart, as these ladies talked about. And you do your soul searching and find out where you are and where your limitations are and the help that you need, and get the help that you need. Because if you are in a position where you're a parent or you're a leader in your organization, you need the help first. You need to have the structured tools to be able to be there for someone else. So you can't run a business, you can't be a parent, and you can't be a good citizen if you don't look in your heart and search yourself first, and find out your shortcomings and address that and acknowledge that. Because one of the things I can say out of all the achievements I've ever gained in my life, the most achievement that I can say I am proud of is I found myself. You know, I found myself, and I at the time with pandemic, I was in my doctoral studies, but I was a registered nurse, and I saw a lot. I saw a lot out there in the trenches, and my mental health today is healthy because I'm able to get it out. And I'm able to see myself helping someone else. I'm able to be an avenue for someone else that can cross them over the bridge. And just to be a resourceful person that if I can survive it and I can make it, you can too.
Mm-hmm. And you were a hub, and that is what we want our schools to be a hub where there's resources and there's networking, and if the solution can't be met there in the school, at least they can send you and hold your hand and walk you to it.
Absolutely.
That's going to support our.
Absolutely. That's what we need now, is
Yeah.
to hold hands. I know in some cultures, they have certain traditions that you don't hold or shake hands or make eye contact. And I was talking with one of the ladies here, and I was saying that in order to be able to help a lot of people now, we have to be able to accept the culture, understand the culture, because that's the first step to be able to break the barrier, to be able to help someone heal mentally. It's no more traditionally sitting on a psychiatric sofa. You have to respect that culture, that person, understand where they're coming from, and then be able to win their trust to help them mentally.
So I think we're probably close to time. Is that Q&A a little bit?
Yeah, it's on. Thank you for the very nice discussion. I just love the whole day here, I must admit that. But there is something I have noticed. I don't coach the children. I more take care of the parents, if I put it that way, in career and life and leadership and in companies. And something that I'm raising now much more than I did before Corona, that is the wealth and financial situation. Because I learned that the hard way, that when I was coaching in career transition, and people coming, globalization, different countries, they have visa, they can only stay in the country for a certain way, they can't buy a house, particularly in my country, in Europe, you don't get a loan in the bank, you have children, so you have to move a couple of times, and I know I coach people here in the United States, and they are kicked back to India or to Europe because of visa. This is also, these financial situations, and I think it is important because I found it very difficult to ask these questions as a coach. How can I ask that? How is your financing doing? Because then suddenly it's like, no, we have a problem, we can hardly pay the bills, Mm-hmm. And then, of course, if you then have 3-4 children, then, of course, the question is not only career coaching here, it's not leadership coaching, it's something much, much, much bigger. And this is where I say, okay, we need more support here. I know that the problems are bigger. And I just want to raise that because this is something I have trained very hard on myself to actually be brave, sort of, to ask these questions. Because they have arisen much more than before here.
Okay, so let me try to answer that. So yes, definitely, it is very important to ask those questions, as these financial constraints do really cause stresses at home and eventually passes on to the children. There was a point in my life that I was jobless for 6 months. I didn't know how long that would last, but still, it did affect the situation, the family situation at home. And those are very valid questions that we need to ask every individual, every family, so that we know where these stresses are coming from. And unfortunately, we do have to pay bills, but still, we have kind of this measure of success through the dollar amount, the revenue that we make, right? The income that we make. And we need to start taking that out. And someone mentioned here earlier that the richest people in the world feel satisfied but unfulfilled. Mm-hmm. And, you know, that's really something that we need to look into. How can we get them fulfilled instead of just being, you know, temporarily happy?
Yeah. And I think it also speaks to, because those stressors come up, it's even more of a reason, like we know that's going to happen in life at some point, is to teach those emotional intelligence, the regulation skills, and then as well as what I've noticed that's been really helpful when educating young adults that have been through the pandemic or they were in high school and now they have these anxieties, is teaching soft skills. Skills that you can transfer from one career to another, because they've already seen that with their parents. Oh gosh, this is so stressful. Dad was in this job, mom was in this job, this one career, and had to totally pivot. It's a concept that if they can understand that's okay, you'll figure it out. You can rework it. It's not the end of life. You'll survive. But building those skills up so that they understand there's options and they feel the power to be able to drive their own life.
When it comes to alleviating stress, we want to try to implement listening to music of your choice. Not headbanging is too much now, but listen to music, getting outside with nature, finding something that you like, whether it's art, painting, drawing. Find something that's relaxing. Just taking away the phone sometimes. Social media is hype. As my daughter would say, they are hype, and you can find everything on there that can just cause your stress to go even further up. Just try not to, try to be away from your phone sometime, and just try to hear yourself breathe and hear your heartbeat.
I think we have one more question over here.
Thank you. Everything you said is really hitting home for me, but I wanted to share with you that I really do support having the schools involved, and I've done a lot of talks within the schools. But what happens is everybody points the fingers at the schools, and I think there's so many stops along the way with our children that we're missing. I think we're not seeing enough, and no offense to anybody that's a pediatrician in here, but I think even doing those, going to the pediatrician, going to the dentist, having those conversations with those children, everybody should be made accountable for that, because you find sometimes our children, there's the children that love being at school because that's their safe haven, because their home life is a shambles. Then you have the other children that love being out of school because they're being bullied. So you have the two different types of students in the schools. And the one cannot wait till summer. The other one dreads the summer because they're left to be on their own. So I agree with you. I think maybe the schools should come together and find who they can pull in onto their team. And I see it as doctors. I see it as pediatricians. I see it as the dentists. I see it as your churches, and have one big team. And I've watched these teachers when I've gone in and spoken to their classes. They're exhausted. They need help. The kids need so much help, and they're not even teaching anymore. So I think when we talk to the schools, it's to have the discussion, who do you need on your team? How can we make that happen? Because I know long ago I used to point the finger and say, well, they should be doing this. They're the teachers. Well, they can't do everything. And then some of the parents aren't even equipped to do it because they're struggling. I grew up in a home where my dad drank my entire life, so there was no support there at all. So I think when we look at this whole school system, I love what you said. I just feel like let's think a little bit broader and have the school look at who can I bring in on my team into the school, and let's work together. Even the school nurse that you have there. A lot of these individuals, they don't work over the summer. If you talk to any colleges, they're working with these students throughout the school year. Those kids go home. If they're out of state, they're done. So they're left to their own demise in the summer, and that might be them, they're going back to where all that stress and trauma is. So we have to do better with allowing our therapists to be able to treat these students after school is over and across state lines. That's what's a big piece that's missing. So just for my 2 cents.
Well, and I think what's resonating through what you said was, it's mirroring that idea of school being the hub. Because I will tell you, that's exactly what I learned as a special education teacher and case manager when I was in the school system, is that you become the connector. And in my work now, parents they go, when I ask, they go, hey, I need an ROI for anyone that you're working with. Is that, I need your physician, if somebody's doing medication management, who else is part of that support team? Because we all need to be talking, we all need to be consulting, and so that the hand and the foot knows what's happening, because otherwise we're not going to be making enough progress, we're going to be pulling in different directions. So I think that's exactly what you're sharing here is, yeah, we can't just point the finger at the school. No, we can't, but we can say that schools, your role is to be our hub, to be our connector. I think that is okay. And then just to change that mindset in our communities, and we can start it now. We can say, you know what, I'm meeting with this child. Who else can I talk to so that we can work together? And I can share my expertise, and they can share theirs, and we can help that child so much more. And then it also lifts up those parents, and it takes a village. Exactly. It's too much for just the parents. It's too much for just the school. But if we come together, we can do it. And we can really make some significant and lasting change.
Dr. Ryan, I think, has a question.
Okay.
Well, a lot of people have mentioned today about the fact that the world is changing very quickly. And I imagine that's going to be doubly true for kids who are growing up post-pandemic. I was curious as to what you thought is going to be the most significant risk factor for youth mental health in the next few years as it goes.
The risk factors for the youth? The risk factors for the youth?
Risk factors for youth mental health, yeah.
The risk factor is key of what we're discussing now, not having the correct tools implemented in the school system. They need the mentorship there for the teachers to be able to help the children. So those risk factors are the barriers of what we're trying to prevent now by trying to set up some type of peer support, mentorship in the schools. If we start off with something small, to at least pilot that, because once again, mental health is like a taboo. But when we start off small with that and they see the productive outcome from what we're doing, then it can grow. Then we can implement it a little larger.
Yeah, and those risk factors that Dr. Joan is saying is no different than the risk factors we see now and the risk factors we saw before. Yeah. We weren't educated enough to be able to handle this. So we still need to be educated. So actionable steps, it's just 2 steps. First is take care of yourself. Number 2 is spread the word like a bad Ponzi scheme or a pyramid scheme.
Yeah.
But it is a compound effect when you take care first of yourself.
Yes.
Because you change and then everything around you changes.
That's exactly right. Because once you know that you're the flower that's in that garden, regardless of how many weeds are there, you will show out to be better than the weeds that are around you. And that's what we want to do.
Thank you, panelists. Thank you so much for this meaningful conversation. This is a topic that is really near and dear to my heart. It is how I became a mother.